Welcome back to the Skinfluence Podcast. I'm your host, Dr. Dustin Portela, and today's guest on the Skinfluence Podcast is Dr. Mary Alice Mina. She is a board-certified dermatologist and Mohs surgeon that practices in the Atlanta, Georgia area. Dr. Mina is also an international speaker. She is a podcast host as well, and we'll link her podcast after this episode. And she's got nearly 2 decades of clinical experience helping thousands of people to feel confident in their skin again without overwhelm, without 12-step routines or other gimmicks. We're excited to welcome Dr. Mina onto the podcast today.
Thank you so much for having me. It's such an honor.
Well, I appreciate you reaching out and having me on your podcast as well, and looking over, kind of your area of focus with your online content. I think really overlaps a lot with the patients that I see and that I speak to online. And those are those women kind of approaching middle age who are starting to notice a lot of things changing in their skin. And there's a lot of information out there, some of it good, some of it not so good. How did you get into this space of speaking to this particular kind of patient who are seeing all these things and are frustrated by the changes, but also they don't know where to go?
Yeah, absolutely. Well, ask me how I know. I am that woman, right? Like, I'm 46 and I started, probably like you, I was on the track to be a doctor and I had my life all laid out. And then the pandemic kind of put a pause on so many things. And I turned 40 in 2020. And I remember thinking like, oh my gosh, like I'd never noticed my neck before and my skin seemed different. And I also hadn't really been taking care of my body like I should have. I had just kind of naturally been thin and ate whatever I wanted. And all of a sudden these bad habits of mine were catching up to me. And I realized like, wait a minute, I'm kind of midlife at this point. And where do I want the rest of my life to go? And a lot of my friends and patients were asking me these questions and, they're aging alongside me. And I realized there's so much noise and nonsense out there. And also as a woman, there's so much pressure to look like we're not aging at all when there are so many changes happening in our body. And so I wanted to better understand that, not just for my patients, but also selfishly for myself as well.
Yeah. The, understanding of what menopause is, there's a very medical definition to it. The absence of having a cycle for 12 months, your FSH, your LH levels can be measured. But perimenopause is now getting thrown into this conversation as well. And I've had women who are just into their 30s talking about perimenopause. And I'd love to hear, what is perimenopause? And is there any medical definition, or do we have people that are at, a 20 different year age gap that are experiencing similar symptoms?
Yeah. So, finally we're talking about menopause and you're right. Menopause really is one day in a woman's life. And it's really something you can only retrospectively look back on. And you have to wait a year after your final menstrual period. So that's menopause, one single day. But what really, I think a lot of people are talking about, or the symptoms they're noticing, are what happens during perimenopause, which is that time before menopause. And the problem is we don't get like a little date or a checkbox or something that says, hey, an email like you're in perimenopause. Everyone's symptoms are different. It can last sometimes 2 years, up to 6, 8 years. It can be this prolonged period and you don't really know you're going through it necessarily at the time, especially if you're not used to associating some of these symptoms with perimenopause. So think of, it's this like wild roller coaster ride where there are ups, there are downs. Your estrogen, unlike in menopause where it's pretty much, flatlined, it can be quite volatile. And as you can imagine, that can cause a lot of symptoms and so many different symptoms. As you know, like estrogen affects every part of your body, every organ system. And so everyone will have a different experience. So I think that's why, we're finally talking about it. But I also think it's important not to, it is possible to have depression or certain symptoms without it being perimenopause. But it typically is about 2 to 6 years before menopause.
Gotcha. Now, I want to get into the skin manifestations, but maybe we could touch first upon kind of the systemic symptoms that a woman might experience in perimenopause leading into menopause. What are kind of the physiologic internal types of changes that we often hear patients bring up as concerns when they're visiting their primary doctor or sometimes even their dermatologist?
Right. Yeah. So let's start with, I guess, primary care. Most common symptoms that I think the lay people are familiar with, right, are hot flashes, like the
Hmm.
woman who's experiencing her own personal summer. She is sweating, everyone else is cold, and she's having to put a fan on. And these, can be quite, distressing, right? I mean, I have my staff members going through it, right? So hot flashes are a big one. Problem with sleep is another
Yeah.
one. So having trouble sleeping is something I'll hear a lot, and just having trouble falling asleep, staying asleep, right? More so than what you would expect for just stress and things like that. So those are common symptoms. Mood issues. I think this was really, I didn't realize this till I went and studied for my menopause certification exam, that actually some feeling depressed all of a sudden, having new anxiety, right? It's more than just, oh, you got a lot going on, right? Like this is kind of your body responding to that fluctuation. So those are some of the kind of symptoms, but really it can be a stiff joint. Frozen shoulder is frequently discussed, but it could be really any joint. So those are some common ones, but again, it can affect any organ. And as dermatologists, right, like what do we see? I hear someone come in saying, I have never had a saggy neck, and all of a sudden I'm noticing all this crepiness or skin laxity, right? Or they feel like I get this a lot. My face has just fallen overnight. That's a
Hmm.
common one I hear.
Yeah, we see a lot of those in my patients as well, just the skin laxity, and that's due to significant collagen loss. And
Right.
maybe you have a different figure. I've heard that women can lose up to 30% of their collagen in a 5-year period heading into
Yeah.
menopause. And we
Yeah.
commonly talk online about losing about 1% per year after the age of about 30. But then in that period where your estrogen significantly drops, it's so protective to your collagen that you can lose 30% or more in such a short period of time.
Right. Yeah, you're absolutely right. And so that's why I kind of joke, like in your 40s, I'm thinking about collagen banking, right? Like I'm
Hmm.
in my collagen building era, right? Because it's like investing in your 401k. You know you're going to need it at retirement. So doing all the things you can to help maintain your collagen and build healthy collagen, because we do know there is this precipitous drop at menopause.
Yeah. Speaking of collagen, I think it's important for listeners to understand it's not just the collagen in your skin, but your bones, your ligaments, your
Right.
tendons. Collagen is such an important molecule that is not only the structure and function of our skin, but our internal system as well. So, what are the biggest strategies that you find helpful for banking that collagen, for preserving it, for building it while you can?
Yeah, absolutely. So we're dermatologists, so let's talk about like the skin stuff first,
Hmm.
right? Because I
Yeah.
think that's what people want to hear. And I would say number one is still sun protection. We know that this, of all, we can't modify our genetics, right? But we can modify getting sunburn, getting tans. And so sun protection, that includes wearing SPF daily, but also other measures, right? Like wearing a hat, sitting in the shade, wearing sun protective clothing, right? We know that the sun is such a huge accelerator of collagen loss and elastin loss. So sun protection is still number one. It's still the GOAT. And if you're not doing that, then really, why waste your money on any of these expensive in-office things? The second is a retinol or a retinoid, right? Like we know there's such great data behind this showing what a powerful collagen booster it is in the skin. And so I really recommend getting on a retinol, a retinoid, which is a prescription version, and sun protecting. So those are really my favorite skincare products, and then probably like an antioxidant of some sort, whether
Hmm.
vitamin C, whether you want to do exosomes, if you have some peptides you love, like you can throw that in. I would say that'd be like number three, but number one and two, sun protect, and then get on some sort of retinol.
Yeah, I've often told my patients if you're doing sunscreen every day, retinol at night, and some form of an antioxidant, you're probably covering 90%, which is a number that I made up in my head, 90% of what your skin needs unscientifically. And you can get more benefit by adding on some of those other products, but generally they're going to come at a larger price point, and
Yeah.
it's kind of diminishing returns after you get those three core foundation things in there.
Yeah, absolutely. I kind of make up that number too. Like, do that and then come see me for the last 10%. But the other thing I'd like your listeners to know that they can do at home is lifestyle modifications and habits, right? This is something that I'm guilty of totally neglecting while I was trying to build my career and go to school and study and all that, is that I did not prioritize my health and
Mm-hmm.
healthy habits. And so when I see these like 20-year-olds, even, or, 30-year-olds stressing about their collagen and their skincare routine, like really, I want to tell these people, like, this is the age to like start focusing on healthy habits, because
Mm-hmm.
that's going to help your skin so much down the road. So things like prioritizing sleep, your diet, looking at what you're eating. Are you eating a lot of processed food, high sugar, or are you eating, whole foods and protein and things like that? Stress management, right? And we don't talk enough about like how much just daily life stress really wreaks havoc on our skin. So focusing on these habits as well are so important, and I think we don't give them enough attention either.
Yeah. Is there a specific roadmap you try to outline for your patients or your online clients on implementing those lifestyle, habits and behaviors? Do you prioritize one and then move on to the next, or how do you approach it?
Gosh, well, a lot of times I'll just kind of share what I'm doing, right? I think certain ones are easier for other people. So, and I'll try to just share some tips that I'm doing. I was a vegetarian for decades. And I finally realized I needed protein. I was kind
Mm-hmm.
of carb loading because I was hungry all the time, but really what my body needed was protein. So looking at your diet, I think, is a huge one that we can do. And figuring out, are you eating high quality protein, whether you want to be vegetarian or not? It is harder, but you can do it.
Mm-hmm.
And it's certainly harder as vegan as well, but really prioritizing protein intake in midlife. And I think, at least when I grew up, it was all about like low fat, no fat, counting calories. And now I realize, like, forget counting calories. I need to count protein. So I
Yeah.
think that's super important. And I think sleep is a big one. At least growing up too, like I felt like medicine culture is so terrible for sleep. It's like we were supposed to be proud of how little sleep we got. And so I just want people to know, like, be proud of how much sleep you get. Like 7-8 hours is great if you can do that. But I tend to start with sort of like nutrition and sleep, because you can, I feel like, make some real good changes with that. Managing stress, right?
Yeah.
That's always a challenge.
Yeah. When it comes to oral collagen supplements, what's your opinion on those? The collagen hydrolyzed proteins that people can buy and mix into their drinks or their foods?
Yeah. So there is some data saying it could be helpful. Again, I would start with your diet first,
Yeah.
right? And look at the protein that you're eating in your diet. And if you're not getting good protein there, I don't think a protein supplement is going to be all that helpful. I kind of joke, like, I can only put so much stuff in my coffee and smoothie. And so my smoothie's already got protein powder in it, and my coffee has creatine. I just don't have enough beverages to add a collagen supplement personally. But
Yeah.
hey, you can buy it pretty affordably in bulk and use it. It might help. But again, I think it's all about prioritizing. And for me, I'd rather get my protein sources through my diet.
Yeah. I take a very similar approach to you. If it's an area where people are struggling to consume enough protein, but they can mix it into a drink, I say go for it. Very little downside, and there is some upside potential there. So
Yeah.
any other high impact ingredients that you often recommend, whether it's a skincare or dietary, and anything that you think is just a waste of money?
Gosh, well, we haven't talked about estrogen, right? So I don't know
Yeah, I
if
did want to
you.
get there for sure.
Okay, so I'll
Yeah.
save that. But I mentioned just a minute ago that I am taking creatine. Right, we are
Mm-hmm.
seeing that. I used to think, oh my gosh, like that's for like bodybuilders. That is
Right.
not
That's
for
your gym
me.
bros. Yeah.
Exactly. But now I'm seeing a lot of data showing how not only is it good for your muscles, but also for brain health. So
Mm-hmm.
I have been looking into that more. I am not a huge supplement person. Again, I think supplements should be supplemental. So I try to incorporate things more so through my diet. But if there are certain things you're struggling with, I love salmon. So I feel like my fatty, omega 3s are
Yeah.
totally fine. But if you struggle in an area, then that is what supplements are for. And I do take vitamin D. I think that's a great supplement for people, especially in midlife. And I know that, again, I'm very careful with my sun protection, and you can always get your levels checked too. But those are, I guess, some of the ones I would think about. I'm curious what you tell your patients or listeners.
Yeah, my philosophy is, very similar to prescribing medicine. My goal with my patients is we'll use a medicine when it's appropriate. And if you no longer need it, my goal would be to get you off of it. And that might be, of course, antibiotics, but it might be a topical steroid or a biologic. If I've got a patient who's been free of psoriasis for 2-3 years and they tell me they'd like to take a break, I'll support that. And I take a similar approach to supplements. I prefer, when possible, to measure. And if there's a true deficiency, it's a perfect opportunity to supplement. But if we can restore the body to homeostasis, they shouldn't need to take a supplement forever. If they have a robust diet and good sleep, then I would prefer that we get them off the supplement, because I've seen a ton of patients that have come in, they've been to a functional medicine doctor who took them off all their medicine, but then gave them $400 a month worth of supplements that they're supposed to take the rest of their life. And I'm not sure that the trade-off is really beneficial in that case.
Yeah, absolutely. And it's hard to know what you're really taking, if they're interactions. I mean, we've seen stories of liver toxicities, right? From you don't
Turmeric
necessarily know,
yeah.
like every pill you're taking might have something that in excess could really cause harm. So yeah, I think trying to get it in a more natural way, and if you're deficient, sure, then replete.
Yeah. So that does bring us into topical estrogen. And this is a topic I'm getting asked about on a weekly basis. And I see questions come in all the time online. I think theoretically it makes sense. We're getting low on estrogen at that point in our life. You can replace it. Does topical estrogen do any good? And should more women be using it?
Yeah, well, that is the $1 million question, right? And I'll start off by saying this is grossly understudied. There are some studies. They're small. Sometimes they're sponsored by the company making it, right? And there have been a little bit of conflicting, actually, but some studies show that when applied to the skin, it can boost collagen. It seems like it works better in sun protected areas, which is kind of a bummer, right? Because your face maybe has a lot of sun damage, and putting on topical estrogen isn't going to be as helpful as if you put it on your inner arm, right? But when I get this question too all the time, and I will first actually use this as a great opportunity to talk about where we know topical estrogen is so powerful and so important. And that's the vulvar skin, which I think I joke it's sort of like a forgotten area. The dermatologists don't really want to talk about it, and we sort of forget its skin. And then the GYNs, like, they've got so many other things to talk about too. But we have amazing data showing what, honestly, like, I don't want to speak too highly, but it's almost like a miracle cream for vulvar skin in perimenopause, menopause, and beyond, that it's truly a life-saving medication. It can help prevent UTIs, which are a big problem, cause for morbidity and mortality in our older patients. And the skin there is very estrogen responsive. So I usually let that be a segue into, well, hey, you're interested in topical estrogen. Are you using topical estrogen for your vulvar skin? And a lot of times they aren't, right? Or they'll say, well, I'm on systemic therapy. I don't think I need to be on it. And you actually need both. Or they think, well, I have a history of breast cancer, or I have a family history, and they're scared that they can't be on it. So again, this is, I think, a great conversation, because for a lot of these women, they didn't even know that was an option. And so I try to encourage them to be on that if appropriate, or talk to their doctor about it, right? And then I say, look, if you're on it and you want to use, if you're doing estradiol, you're using it on the vulvar skin twice a week. If you want to put it on your face skin or your décolletage, your neck, whatever, I don't feel like it's going to be harmful, and that it could be helpful, because we know our keratinocytes, our skin, does have estrogen receptors. They also make other forms like estradiol that's a little bit weaker. That's more of like a nightly thing that you could use. So I would say it might work. To me, it makes sense that it would work. And we know it works in the vulvar skin, but we need more data. talk to your doctor about it, right? There
Yeah.
may be a few people I wouldn't put it on. If you have really, really bad melasma and you're really struggling with it, may not be the best choice. But again, I sort of put this with our that we talked about earlier, sunscreen first, retinols, and then, an antioxidant. I sort of put this in that fourth category that, hey, worth a try. If you're using it for the vulvar skin, we know it's really effective there. Maybe put it on your skin. I'm not too worried about systemic absorption and severe side effects with it.
Yeah, I take a very similar approach. And I don't know outside of the vaginal estrogen, if there's a commercially available preparation intended for facial skin. I find that I have to compound it for most of my patients, which makes it difficult to study from batch to batch and know if there's consistent results. And so your point to a lack of evidence here doesn't mean that there's not a benefit. We just don't have data that we can cite.
Yeah. So absolutely. I think the first step is to kind of really, I think most dermatologists, right? We're all about simplicity, because if you've got this complicated routine, it's expensive, it's time consuming, and you're not going to be consistent on it. I mean, eventually you're going to stop because it's too time consuming. And so really, I just like to stress your skincare can and should be simple. And it really should focus on, I would say, pair your skin needs with your skin goals. And that's what makes your habits, right? So I had one lady come in, or she wanted me to go over her skincare products, and it was tons of stuff for acne. And I'm looking at her, and I didn't see a pimple anywhere. And I'm like, oh, do you struggle with acne? She's like, well, no, but I just thought I should be using all of these things. And I was like, well, not really, right? Like her skin didn't need those acne products versus someone who has, acne, or maybe you're struggling with melasma or pigmentation, right? So figure out what is your kind of skin struggle, whatever that is. And then you're going to want ingredients to help support that. And then what are your goals? And I use my mom as an example. Like, her aesthetic goals are just live my life and leave me alone, right? Like, I can't even get her to use a retinol. But she sun protects, she gardens, she's outdoors, and she puts on, I think it's like her CeraVe cream. She loads up and it absorbs into her skin. And she's in her 70s and she is gorgeous. And there's no, she has no desire to do anything else. And that is totally fine. So her habits are going to look a little different than someone like me, who's like, well, I do want a little bit of some laser, and I do like my Botox and biostimulants, right? And so you really have to figure out your skin, what your needs are, and then what are really kind of your aesthetic goals, if there are any. And then that's how you get your habits. But a 12-step routine, trying this from TikTok shop, and then this because your bestie used it, or some gorgeous celebrity, and bouncing around, you're never going to get the results. And in fact, I think there was a study that showed it's really less important which product you use and more about consistency, which I think as derms, we know for sure 100%.
Yeah. And nearly every dermatologist that I've spoken to has a very simple routine.
Yeah.
And so a lot of this that patients are finding, it's from the marketing world. It's not backed by science that we need to do that much. So we've kind of covered the generics of skincare, the important things from a lifestyle perspective. And I want to get into those in-office procedures. Yeah. When somebody wants a little bit more, what are the highest yield in-office procedures that are going to help to rejuvenate and restore somebody's collagen, their appearance? They're going to help with fine lines, wrinkles. How do you approach that with your patients?
Yeah, absolutely. So like you said, do all this other stuff, and then come see us for that last 10%, help you cross the finish line, or to kind of maintain, right? Mm-hmm. So lots of great, and this is also where I say save your money on your skincare, because if you do want an in-office procedure, these are a little pricier, and so you don't need to be spending $400 on a moisturizer. Instead, maybe look to something in office. Mm-hmm. So it really just depends on what, again, you're struggling with. I like to give the patients a mirror and say, tell me what bothers you, because what bothers them may not be what necessarily I see. But I think in general, for most people, especially like midlife, kind of doing like a complexion cleanup or like smoothing out the complexion. At this age in midlife, it's not uncommon to have those fine lines, maybe have some discoloration or, maybe even scarring if you've had a skin cancer. But I sort of think starting with a clean canvas and just kind of a nice resurfacing of the skin can be really beautiful instead of chasing like specific lines and wrinkles.
Mm-hmm.
And I just think it makes everyone look better and more rejuvenated, like you just got back from a great trip. And it's going to depend on your skin type. So some people who maybe have more melanin in their skin, they don't have as much sun damage, they could benefit from things like microneedling, I think is a great collagen booster. But if someone really has a lot of kind of sun damage to undo, they may be better suited for more of a stronger resurfacing laser. That does come with a little downtime. But I do find those are great options for sort of the different spectrum. And also depends on what your comfort level is. Like some people, they don't want a week of downtime. They'd rather come in once a month for a series of lighter treatments. So
Yeah.
I do love those for collagen boosting, and I'm a big fan of biostimulants.
And what kind of biostimulants do you like to work with?
Yeah, so the big two one here that we have are Sculptra and Radiesse. So I will, if I'm doing more sort of pan volumizing, I tend to gravitate to Sculptra a little bit more, and Radiesse if it's a little more like localized or focal areas I'm working on, maybe the neck, then I think Radiesse is a great option. But really, I think they're both wonderful. And a lot of times I encourage people, especially if they're really into, they're doing all the right things and they really want to maximize their collagen, even just doing like a vial a year, I think can be really helpful to help maintain, knowing, again, you're going to have that drop once you're no longer producing estrogen.
Yeah. Yeah. And for the listeners, I know you've talked about biostimulants likely on your podcast a lot more. So we have our traditional fillers that have hyaluronic acid. You put them in, they volumize an area. But when we use a biostimulator, what we're doing is we're putting a material under the skin that will actually help turn on those genes and stimulate your body to produce more of its own collagen. And it's one of those things where you really want to go to somebody who has experience with them, that does these frequently. I recently had somebody in my clinic who had Radiesse put in an area that it really shouldn't have been. And it's not easy to dissolve and take away. And so you want to make sure that you go to somebody like Dr. Mina, who does these things all the time and can really help to create that kind of plan for you, because you don't want to spend all that money and then not get the result that you're looking for.
Yeah, absolutely. And I also tell people this is kind of playing the long game. When you leave the office, right, you'll be puffy and swollen mostly from the water that the particles are mixed in, right? And then I tell them that's going to go away in a week. You're going to be like, I look the exact same. So it's almost better to do it. If you're looking for dramatic overnight results, you will be disappointed with biostimulants, because again, it's getting your own collagen, building your own collagen, which I think appeals to a lot of people nowadays who have filler fatigue from the HA fillers that just kind of looked a little overblown, a little overdone, a little stiff. That the biostimulants and the thought of like building your own collagen really appeals to people who want a more natural look.
Yeah. And that takes us back to the earlier part of our conversation. If you're going to do something like a biostimulator, you want to have the right environment for it to succeed in. That's where your good sleep comes in, your good diet. If you're not giving your body the amino acids, that protein to actually build collagen, all that stimulation is not going to do anything. And so it just kind of comes full circle there, that this is a really holistic approach, that it's being talked about more and more, which is great for the patients that are facing this stage of life and want to kind of push back a little bit. And if you don't want to push back, that's okay too, but there's great options if you do. I think this has been really informative. Dr. Mina, where can people find you if they want more information on from you, your podcast, your approach, your PDF guide?
Yeah, absolutely. So if you're like, maybe I'm in my perimenopause era, like I guess I am, right? Like we don't really know till after it's happened. You can get a free guide. It's hi.theskinreel.com/peri. And I'll give you my perimenopause survival guide and how to really thrive in this period. I think also just women finally talking about it and not feeling embarrassed about it, or like, oh my gosh, my life is over, I'm going to be put out to pasture, I think also too is just so empowering. And I just think, wow, this is a pretty amazing time to be a midlife woman. So I'm super grateful for that.
Well, awesome. I'll make sure to have links to those in the podcast show notes. And what are your social media handles if people want to follow you there?
Yes, absolutely. I'm at Dr. Mina Skin. So DRMINA Skin.
Awesome. Well, thank you to our audience for joining us on this guest episode. And you can look for me appearing on Dr. Mina's podcast very soon as well. And I'll have a link to her podcast in the show notes. Leave us a 5-star review wherever you listen to podcasts, and we'll see you next week.